I had a mole removed and it needs to be done again. Does this mean it was done wrong first time? Well, not necessarily. The question is why you're having it removed the second time, I guess. So if you're having it removed because they've left a bit, and usually I guess that would be a shave excision where you haven't got it all down. I always warn people with the shave excision, if there's still a bump there, you might have to have it done again. And potentially with a shave, there might be a dent there and you might have to have that excised. So you might need a revision. That would be classed as a revision. And does that mean they've done it wrong first time? I mean, you could call it that. I mean, it's a bit harsh to say done it wrong. But whenever we do surgery, we are always trying to make things perfect. But I think most / all plastic surgeons, and maybe all surgeons, but certainly all plastic surgeons, will factor in an element of potentially having to do revisions, call it what you will, touch-ups, and potential procedures to make things perfect if they're not perfect first time. So if you want to say that's done wrong, I think that's harsh. I don't think it was done wrong, but there's often an element of that. However, with mole removal, there are situations where it might not be that there was a problem. It might be that so if you are happy with the scar, if the scar looks fine and you're being told you need to have it done again, there might be an issue regarding what the mole was. So if it was a skin cancer, and if it wasn't completely removed when they look at it under a microscope, so what we do is we take a margin often of skin, of normal skin. We often aim to obviously get the whole of the thing out, whether it be a or whatever it is, if it's mole or a skin cancer. Often we don't, you're not 100% sure that it is a skin cancer preoperatively. So we always aim to get the whole of the lesion out. But sometimes when when you have it removed and you have the scar, you might look like there's nothing there. But sometimes when they look at it under a microscope, they say if it comes back as a skin cancer and it's not all out, if it's coming up to the edges of the specimen, if there's not a clear rim of normal skin, then you might need a further excision. So I wouldn't say that's necessarily it's done wrong. That would just be a consequence of it being a skin cancer, especially if they, you weren't sure whether it was a skin cancer beforehand or not. The other type is a melanoma, which is a specific type of skin cancer, which is a little bit different to other types of skin cancer, but mainly because it has the virtue of being able to spread to other parts of the body. And for that reason, we often want quite a large margin around a melanoma. So even if you think it's a melanoma, when you go to remove the mole, most of us would have just remove it with a little bit of a margin, just a few millimeter margin, and then we'd see the aspects of that melanoma. Particularly the thing we're looking for is how thick it is, how deep it is, because the depth will dictate the margin of excision that we require. So it will be usually a 1 or 2 centimeter margin around the melanoma that's required. And usually, rather than just taking a 1 centimeter margin for the first bit of melanoma, we don't do that. We just take a little margin and then we do a 1 or 2 centimeter margin around the scar. Because a 1 centimeter or a 2 centimeter margin is quite a significant margin, and that's a peripheral and deep. So it's quite a large piece of tissue that's removed. So you usually want to be sure, first of all, of the diagnosis, and you want to be sure whether it's a 1 or 2 centimeter margin. So you will kind of routinely require 2 operations. If it's a melanoma, it's kind of standard. So that's definitely not gone wrong if they say it's a melanoma and you need to come back for a second excision. That doesn't necessarily mean the first one was done wrong. It just means the first one was just getting the lesion out and assessing the depth of it so that they can plan the second operation. So if we know it's a melanoma, we will often discuss this with you prior to the first one to say, look, we're going to just take it off with a minimal margin or a few millimeters, 5 millimeter margin, say, and then we're going to if it does come back as a melanoma based on the depth, you'll need another operation. So it's always good to have these conversations before the operation, so you don't get a shock and say, "What? I need another operation," and that's kind of standard. But not particularly. That's always standard, but especially if it's in like a cosmetically sensitive area, you don't want to be taking 1 or 2 centimeter margins until you know. First of all, you have to take a good margin, and secondly, the extent of that margin. So yeah. So it doesn't necessarily mean it was done wrong. There are circumstances where you will potentially need another procedure if you have your mole removed. Some will be for cosmetic reasons, as I say, if it's a bump or a dent, particularly after a shave excision. But if it's a formal excision, they will usually be due to the histological results once we sent it away as to what it was and how much of it, how much of a clear margin there is. If it's not a melanoma, if it's just like a BCC or an SCC or what we call a non-melanoma skin cancer, you usually just need a clear margin. So we usually cut those out with a sort of 3 or 4 millimeter margin and hope just to get a clear margin. And as long as the margins are clear, usually that's acceptable. But they would normally be discussed at a multidisciplinary team meeting to ensure they're comfortable with the margins and the aspects of the tumor. But this is something to be discussed. So yeah, so it's not unusual to need a second operation, and it doesn't always mean that something's been done wrong for the first one. In short,